Hi! Today I'm going to teach you insulin backwards. So what does that mean? Instead of starting with names and memorization, we're going to start with how insulin behaves in your body. We're going to review them in groups using something called comparative learning, which means your brain understands things better when they can see differences side by side. To start, as you may know, insulin is used in type 1 diabetes where the body makes no insulin, as well as in type 2 diabetes where insulin production isn't enough or the body is resistant to it. Rapid-acting insulins like Lispro and Aspart work fast, but they don't last long. Because of this, they're designed to cover mealtime-related glucose spikes, so they're taken right before or with meals. They might be referred to as your mealtime or your correctional insulins. Our second category is intermediate-acting insulins, like insulin isophane or NPH. This has a much slower onset but a noticeable peak. NPH is typically used for basal or background insulin, but compared to our long-acting insulins, this peak that it has requires careful timing with meals. It also needs to be dosed twice daily to fully cover 24 hours. And lastly, we have our long-acting insulins, Glargine and Detamir. They're designed to provide steady background insulin throughout the day and night. While their dosing can impact meals, they don't cover meals the same way that short-acting does. They're considered peakless. They control baseline glucose and fasting blood sugars. These will be referred to as our basal insulins. So we start with duration because it doesn't just help you group insulins, but it also tells you what their job is. Short duration means it's meant to cover meals. Long duration means it's meant to cover baseline glucose. And anything in between has trade-offs that you need to account for. How do we titrate to control glucose but keep patients safe? One of the most important tools is a glucometer. Patients should regularly record their blood glucose readings as it helps us see a big picture of how they're doing. And different readings tell us different things. Our fasting glucose tells us how well our basal insulin is working. Our pre- and post-meal glucose readings tell us whether mealtime insulin doses are appropriate. The key when titrating insulin is to recognize patterns, not single high or low readings. You're looking for consistent trends overall, and when you are making changes, we do so in small, gradual steps. This is usually every few days. This type of approach reduces the risk of hypoglycemia, which if untreated can be dangerous, causing confusion, seizures, loss of consciousness, and serious injury. If too much insulin is given, patients should have fast-acting carbs on hand to help correct it. And that's our intro to insulin.